Hi, I'm Ralph Preston, and every Tuesday we have these Stroke Buddies Recovery and Science Zoom meetings, and we try and bring you some valuable information, and today will be no different. We've got Caity Claiborne from Motus Nova, and she's going to explain a little bit about their products and how they work and how they might benefit you in your stroke recovery. So Caity, welcome and thank you for your time. And whenever you're ready.
Yeah, thank you. Thank you. I'm gonna go ahead and share my screen, my PowerPoint. Okay. Okay, so kind of like Ralph said, my name is Caity. I work for a company called Motus Nova. I'll kind of go over all this in the PowerPoint, but kind of just to give a background about myself, I'm a clinical specialist with Motus Nova. I am a PTA by trade, so I did go to school for physical therapy, and I kind of specialize in stroke recovery. So I do a lot of neuro-based recovery, so stroke, brain injury, spinal cords, kind of things like that. My main one is stroke. That's kind of where most of my experience is. And then I kind of been in a variety of settings, so whether that's inpatient, outpatient, acute setting, long-term acute care, skilled nursing facility, pretty much kind of across the board, everywhere except home health so far. So kind of a variety of experience and exposure from there. Pretty much what today is going to be about is I'll kind of give you guys a little bit of background about the company, the devices we have. We do have two medical devices. One is called the Motus Hand. The other one is called the Motus Foot. So we'll kind of go over that. We'll talk about like the patient specific population that it's for, kind of what it's meant to do. I'll have some videos in here as well for you guys to actually see what it is other than just listening to me talk. And then we'll kind of just wrap it up from there. So as a clinician, whenever I attend meetings like this or things along those lines, I kind of always want to know a few things off bat. So first and foremost, I always want to know when I'm learning about something or introducing it to people, I want to know how much does it cost up front. Because I know for me personally, like finances plays a big part in a lot of things that we have going on. So I always want to know how much is it up front. So we will talk about that in a second. But one thing I do want to mention is that both the Motus Hand and the Motus Foot are both FDA Class 1 medical devices. So we have 24 case studies so far, specifically on stroke recovery with these medical devices. All of it was funded by the NIH, and then we have a bunch of partnerships so far with Cleveland Clinic, we're with Emory University, we're with a dozen VA clinics, and then UAB as well. So the doctor that kind of helped find all of this and like is the background of these studies came from UAB, based on his personal situation and story with his daughter. And then I kind of just want to talk about like how this is different. So these devices are robotic active assisted devices. So it's not something that is going to do everything for you. It's not a device that is going to be something that you take out the house and have to use on a day-to-day basis to get it around. It's something that's going to help work in the background on like strength. It's going to help work on your range of motion. It's going to help get you more functional. So when you do go out in the community in the real world situation, you're able to use what you gained with the devices out there. So a lot of devices like an AFO and things like that, you do wear it out in the community and it kind of gets integrated in your daily life. This is something that's working behind the scenes, that's individualized to you, that you use at home. So when you go out, you don't have to use it. It's not something that you take with you outside of the house. It stays in the house. They are gamified. It's a gamified device, so both the Motus Hand and the Motus Foot get hooked up to a monitor that's attached to games. We have about 25 games right now. That's kind of tailored towards working on that range of motion, working on that strength aspect, to get you kind of back where you need to be. So I do want to mention when we first were founded in 2013, we weren't using the devices that we have now. We kind of were just pushing getting the devices into clinics, getting the devices into hospitals, but it's still kind of left that gap for patients. So when you leave the clinic, if it's just in the clinic, you guys aren't able to use it anymore. So you're only able to use it when you're in the clinic. And then we all kind of know insurance is the determining factor for a lot of stuff. So if insurance says, we're not paying for it anymore and we're cutting you off, but the devices are only in clinic, it still leaves everybody else kind of short because then we don't have access to it. So just pushing it and leaving it in the clinics wasn't really addressing what we were looking for. which was to get neuro patients more increased therapy hours outside of the clinic and at home on their own. So that's kind of when we came out with the devices that we have now. It's something that goes in your home. It's something that you have access to 24/7. You can use it as much as you want, as little as you want. And there's kind of no cap on that. So we do have a few approaches that we go, which I will talk about in a little bit. As far as like billing wise, insurance is the kind of the route we go. But kind of like I mentioned, this is just something that is increasing your therapy hours outside of home. So for some of you that whether you are still in therapy or aren't in therapy anymore, when you discharged or when you went home, a lot of therapists assign home exercise programs, which is great. It's awesome. But sometimes we kind of reach a compliance issue. Patients aren't doing them at home. You might get tired and you just don't feel like doing it, things like that. And it kind of just falls to the wayside. So this is something that's a little bit more engaging. It keeps you wanting to go. It helps you stay accountable, things like that. To kind of stay engaged and continue doing that home exercise program. And then it just gives you a way to also see your progress. So I know for me, with my sports background, it's kind of difficult when when you're facing an injury where you feel like you're not able to see much progress. With the Motus Hand and the Motus Foot, you're able to track your progress as well. So you're able to see where you started at, and then maybe a month later of using it, hey, how much progress have I made, to kind of help with that. I want to do more. I want to keep going, because you're able to see that you are making progress. Whereas sometimes when we can't see the progress, we get a little hard on ourselves because we don't know what's going on. We're frustrated. We're in a position that we're not used to. So it gets harder for us. But I do want to mention this is not just for stroke. Our premise and our background and our studies are in stroke recovery, but we have seen and have helped a wide variety of neuro injuries. So whether that's MS, peripheral nerve injury, GBS, spinal cord injuries, anything like that, we're also seeing benefits as well. So just kind of like an overview and a review, this is not something that is going to replace therapy at all. This is something that works in conjunction with therapy. So even if you are still in outpatient therapy going, so many times a week, this is not something that's going to replace that. Insurance is not going to pick therapy or the medical devices. The medical devices are billed as a DME equipment. So more so like a walker or a cane, that type of stuff, rather than replacing your therapy. So if you are still in outpatient therapy, this is not going to impact or affect that at all. It's a totally separate billing component. So you don't have to worry about that at all. You still get the whatever insurance approved you for, you still get that. It doesn't impact. So we'll kind of go into like the billing aspect. So right now, Medicare and all of the major private insurance companies are approving the Motus Hand and the Motus Foot. I like to tell people we always try, just to see, because it kind of varies and depends based on your specific plan. So I always say if it's something you're interested in, we can try it. Because you guys are going through this group, we have like a specialized QR code that if you say, hey, I want to try this out, I want to see if insurance approves it, and we process your information, even if you get denied, we still offer it to you for 60 days for free. So we'll still ship it to you, we'll still send it to you. You can still use it for 60 days for free. And then at that point, we kind of have a few options. If you say, hey, I loved it, it was great, but I'm done, you send it back. We send you a shipping label, you send it back to us, no contract. That's the end of it. You got it for your 60 days. If you do want to keep using it, we can enroll you in a month-to-month payment plan, which still is no contract. If you say, I only want to use it for another month, you use it for your month and then you send it back. It's never any contract whatsoever. It's very individualized and specific to your needs. So if you want to use it for 4 months and then you say, hey, that's enough, that's fine. Use it for your 4 months and then you send it back. We kind of work with patients where they're at, because like I mentioned, we want to make sure we are not adding any extra burden or barrier on your plate. If finances is an issue, we understand that, and that's kind of why we came up with this company, these devices. We have what we call a financial hardship program, that if you are not able to pay, like let's say, for example, you do have to pay out of pocket for whatever reason. If you are not able to pay it, as long as you let us know, we work with your specific needs. If you say, hey, I can only afford X amount of dollars, we work with that. We work with you to make sure that you're still getting the treatment, you're still getting the care you need, and we're not taking that out of your hands. We never want to be a company that we're giving you something that you like, it's benefiting you, it's helping you, but then we give you a large bill that you can't afford and it's creating more problems. That's not what we want to do. So we work with everybody on a case by case basis to work with them. Typically, primary insurance is approving 80%, and then that secondary insurance is covering that 20%. If you don't have secondary insurance or your secondary insurance doesn't cover it, that's when your copay would be that 20%, but that is still applicable for the financial hardship program. So even with that 20%, even if you are responsible for that copay of 20% and you still can't afford it, let us know. We don't want you guys feeling like, the finances is a burden and we're putting anything extra on your plate. Just communicate with us, let us know, and we'll see what we can do. We do have another option as well. Like if you don't have insurance or you just want to do like a cash-based month-to-month option, that's also an option as well. It would be a month-to-month plan for 2 years. But still, if you say 5 months in, I've had enough, it's still never a contract. You send it back to us, and that's kind of it. As far as insurance goes, insurance bills on a 13th month cycle. So if you go through insurance approves it, and you're still using it after those 13 months, it's yours and you own it. You never have to send it back. Even if you decide, I don't want it anymore, it's yours, you own it. Now, if insurance is paying for it and you decide on month 4 or month 5 or any month, I've seen all the gains that I would like to get, or I'm just not interested anymore. Insurance does not have to keep billing on a 13-month cycle. You send it back, and that's kind of where it cuts off. It's same across the board, whether it's insurance or whether you're paying out of pocket. It's never a contract. It's always a month-to-month basis. If you are paying out of pocket without insurance and you are paying those month-to-month for 2 years, it's 2 years before you own it. It's only the 13 months through insurance. But same scenario applies. It's never a contract. If you're done and if you've reached your max for whatever reason, we will never ask you to explain why you don't want it. If you say, hey, I've had enough, we give you the shipping label, the boxes that you receive the devices in, you send them back. We handle everything else, and that's kind of it. We're not forcing you into anything. You're not signing anything. We're not requiring you to stay with us for so long. We want to help you out as much as possible. So I kind of want to show you guys now the videos. These are some patients that have used it. So the two on the left is the Motus Hand. So this is a screen that you'll get, and then that is the Motus Hand device. If you get the Motus Hand or the Motus Foot, you get whichever device as well as the screen. You do not need internet. So if you don't have internet, that's not a problem. You're still able to get full access to all the games, still play it without internet. You get the device and the screen that comes with it. All of it's included. So I'll let you guys just kind of see it. These are just a few of the games that we have. But like I mentioned, it is active assisted. So it does want you engaging and you working. If for some reason you're not able to, like you're completely flaccid and you have no control over that limb, you're still able to use it. The device will do it for you and work for you until you are able to get strength back and get to the point where you're able to do something. Once you are able to do something, it goes on your level. So if you come in on a Monday and you're using the device at home and you're a little bit weaker than normal, it's going to provide more assistance. If an hour later you're playing it and you're stronger and you don't need as much help, it's going to back off. So it's constantly adjusting and adapting to where you are as you're playing it, to kind of help you out. If you have a situation where you hit a certain range of motion and you're in pain, let us know immediately, stop the game immediately, and we can program it in to where when you're playing the games, that pain level is your cap. The device will never push you past it. That will become your stopping point to where you will not be pushed through it. The device is set up to go through the full range of motion. So initially it will, unless we know there's pain or there's some type of issue, and then we can set it on the back end to where it's not going to push you through that range of motion. So these are just some more videos, some other games of patients playing with the Motus Hand and the Motus Foot. Both of the Motus Hand and the Motus Foot have the same exact game. So they're all 25 games. They're the same games. One's the wrist and one's the foot. When we get like a little background information on you, like what happened, kind of like a history. And if we know that you might not have that much motion or that much movement, that much range of motion in your wrist. We will put in there in the system so that it knows that, because it kind of recommends games for you as you're playing. So it'll recommend like a lower level game for you. You still will have access to all 25 games. So we have low level, medium level, and high level. You will have access to all of them. But we can tailor it to where the recommended games it's giving you is more so suited to where you're at. And then as you progress, you can keep going forward. But like I said, you will have access to all of them. So if you just want to try a higher level game at some point, you're welcome to do that. It'll just recommend ones that are more so on your level. And then this is the foot. Like I said, same games. It's just one is a foot, one is a hand. And then still with the foot as well, it is tailored and specific to you and individualized to you. So no one is going to get, two people are not going to get the exact same assistance. If you have one patient that is a very high level patient, it'll help less. And if you have a patient that is a low level patient that needs a little bit more help, it'll help more. So it's very specific to your specific needs and kind of what you need. Okay. So those are the videos. Let's see. Oh, they're all playing at once. Okay. So let's just kind of going over what's all included. I kind of touched on the screen. You get the screen. You do get the Motus Hand or the Motus Foot. We give you the prepaid shipping. You have ongoing tech support. And then we kind of pair you with what we call a recovery coach. I like to think of it as a personal trainer. Basically, it's just someone that every 3 weeks they're checking in with you. They're seeing how's it going? Do you need help with anything? They're keeping you accountable. They'll help you set goals, help you stay on top of those goals, things like that. They are not a therapist. They have backgrounds in like coaching, education, things like that. All of the clinical specialists, which is my position, we are all therapists. But the recovery coaches are more so like a personal trainer that's going to keep you motivated, keep you engaged, things like that, and kind of be there if you need anything. You are able to request like more frequent meetings. It is going to be every 3 weeks as a standard, but if you want to meet with them every week and you want to request a meeting, that's fine as well. They'll meet with you every week, kind of based on what you need. They help you with that initial setup. So from the time you get the device throughout the time you have it, you will have that recovery coach. They are your go-to person. They are your first point of contact. If you decide to go with either device, you will have my contact information should you need anything. But that recovery coach is kind of a better suited person, a primary point of contact to reach. If for whatever reason you cannot reach them, feel free to reach out to me, call me, email me, whatever the case might be, because we're here for you. We are here to help you in whatever you need. Pretty much from here, like the next steps that we like to say is if it's something you want, we can schedule a call. We can talk just to get basic information. Pretty much all we need is like your doctor's information, basic generic information like date of birth, email, shipping address to where the device is going, and then your insurance so we can process it. I stay with you the whole way until you're paired with a recovery coach. So I'll give you updates like every week, every other week as to, hey, where are we in the process? What time frame are we looking at? Where are you at? Things like that. So you guys are not left in the dark. I never want to get someone signed up, they're excited, and it's like, hey, it's been a month, I haven't heard anything. I want to keep you informed. I want to keep you engaged so that you know what's going on and you're not just waiting. It's been a month and I don't know anything. So I'm with you up until you get that recovery coach. And then I kind of pass it on from there. This is my contact information. If anyone needs it, if anyone wants to write it down, my number and my email, should you want to email me, text me, call me, whatever the case may be. And then we can kind of go from there. But yeah, that's kind of the company as a whole, the two devices we have, and kind of a little bit about what we are offering. And yeah, that's kind of it. If you guys have any questions, feel free to ask questions. But that's all I have.
I'll put the contact information for everybody out there in YouTube land. I'll put the contact information in the description underneath this, underneath the edited video, like I always do.
Okay, let me turn my screen share off.
Yeah. All right. Questions? Linda, you got your hand raised.
Yes, my question is it possible to be approved for the hand and the foot at the same time, or do you have to choose one or the other?
Yeah, good question. So it's kind of both. You can get the hand and the foot, you just cannot get them shipped at the same time. So what we would do is typically see which one do you want more. If you say, I feel like I'm having more issues with my foot, we start the process with the foot, we ship the foot out to you. Once you've decided like, okay, hey, I want to start with the hand, you let the recovery coach know, and then we'll put in a claim to send the hand to your house as well. So you can still get both. We just cannot queue them both to be shipped at the same time.
Okay, thank you.
We have a question in the chat. Do you have any patient videos? I don't
So
know.
in this PowerPoint, I don't, but on the website, which is just motusnova.com, there is a whole page of testimonial videos. Let me see if I can pull it up and show you guys. That has like before and after videos of this is what a patient was doing before, this is what they're doing now after X amount of time using it. And I actually do have some videos I can pull up and share it with you guys. Let's see. All of them are set up on our page under the reviews. It'll kind of show you specifically, it's over a 30-day period is what we kind of show for the before and after, before what they were doing, and then after 30 days of using it.
I'll also put the link to this page in the description under the video.
And then same with a few of these down here. So we're able to like work on like fine motor skills as well, which is what brushing your teeth, getting the toothpaste open, things like that. So the left video that's playing right now was before he was using the Motus Hand. And then it's going to switch to after.
If you click on those, they become bigger.
Um,
I'm just curious if they're embedded in the page or.
yeah, I think they're on the page because it's not letting me enlarge it.
I can see them okay on a computer. I just wonder about
Okay.
people on their phones.
Right. Yeah. So yeah, this is a whole page of testimonials, things like that. There's a bunch of videos on here. If you guys want to go through it and look at them, there's a lot. And then we do have some actual patient videos using it as well. Like if you guys wanted patient specific ones, I can always get that for you. One thing I did forget to mention that I do want to say is we have a wide range. So we've had patients as young as 4 using the devices and then as old as 97 using the devices. So it's kind of a large range of who can use them. But we've seen pretty much all ages.
DJ, you had your hand raised? Got a question?
Yes, I have a question. Does this work on clonus by any chance?
Yes.
So I've,
So
I've
we
been-
have,
it's been 2 years and I still have a lot of clonus in my right leg.
okay. Yeah, so we have like a stretching game was what we call it. That is typically when you start and you turn the monitor on, it's going to recommend that first. So it's going to work on, it's 5 minutes each. You can do it as many times as you want. Working on the device passively moving you to work on decreasing and getting you out of it before you ever start playing the games. So it's one that that's the only game that it does not want you to do anything. It's doing it for you to kind of work through it and work with your muscles and kind of decrease that before you start the game. It is 5-minute increments, but like I said, if you wanted to do it for 20 minutes, you can just keep starting it over. And then it'll kind of give you a snapshot of like, hey, where were you when we started the game? And then where are you now? If you've done it for 15 minutes, how much range of motion do you have? How much resistance are you giving? Kind of things like that. So you know how much did it help me before I even start the activities.
Okay.
Yep.
Interesting. I don't think I've ever heard of anything that helps with clonus, so I'll make note
Yeah,
of
so
that.
one of our big ones is clonus. We have contracture management, tone reduction, and spasticity reduction. So
Contracture management, that's interesting. Keeping them from going further?
yes, so we have 3 different grips, which is what you would get with the Motus Hand. We have a severe contracture grip, we have an intermediate, and then we have a finger extension grip.
Yes,
Standard
yes,
operating
yes.
typically, we say if a patient cannot open their hand actively and put it on the table, we typically recommend the other grips. If a patient wants to get the Motus Hand, I always send all three grips with them so they can kind of change them out themselves. We had one patient, he's on the website as well as a testimonial. When he first started with us, he was not able to open his hand at all. He was completely contracted. After 91 hours, was able to open it. So it does take time, kind of like anything. But it's one of those things that we have made the games engaging to where you're gonna keep going. And then as you keep progressing, you will see some return. Obviously, we can't say 100% return, but we have a lot of testimonials on the website as well as like case studies that we have. If you guys are ever interested in getting that kind of goes over how many hours they put in, where they were before, where they are now, which device they used, things like that, to kind of show progress. But yeah, contraction management is a big one for us. Tone, spasticity, clonus, kind of all of that are the big ones.
I would assume there's some limit to the amount of contracture, and a therapist or somebody would have to determine that.
Typically, what we say is if they are able to passively move it at all, even if it is a little bit, we work with that because the hand is kind of intended for contraction management. If they are able to passively do anything at all, they're appropriate and it can work for them. It is a case by case situation because sometimes we might think it might not work and it might. We have patients that we didn't think it was going to work on. They tried it anyway and they did see improvement. But with that situation, typically, like if a patient were to go for it and we do the Motus Hand, we would send the nearest rep to their house to actually get hands-on with them. Because the recovery coaches are able to get on video with you and kind of help you out. But sometimes you need a little bit more hands-on. So if the recovery coach cannot assess or kind of help you via phone or via video conference, we will send out the nearest rep to the home to actually get hands-on with you.
Okay, and does it also deal with contractures in feet, like ankle roll?
Yep.
Okay, there's got to be
So
some.
that's a little more case by case basis just
Yeah.
because the hand, we have three grips that we can switch out to like kind of fit wherever your hand is at. The foot, we don't have different placements or different grips because it's just the device. But that's another one that like we would send somebody out to get hands on with them because with the Motus foot, we have the ability, like if the patient's foot is going inward or outward, we have the ability to, if we can position it passively in neutral, we can lock the device there. So while they're doing their exercises, it will not be able to go in or out. So then you're solely working on strengthening it in one plane versus, because sometimes when we have patients that go into dorsiflexion, they might get a little bit of inversion. So we're able to lock it to where you're not going to be able to go in and you're just focusing on dorsiflexion, plantar flexion.
I was asking because I'm trying to help a young man who has pretty severe contractures. Probably would work with his hand. I'm not sure about his feet. Basically his feet are on sideways,
Okay.
and he can't weight bear
Yeah.
on them. So I think he needs.
Yeah, that would be another kind of like a contraindication. We do like open wounds, not a good fit. And then if you're not able to weight bear for the feet, not a good fit just because you are going to be putting your foot down. But in a case where you have a little bit of supination, but you are able to weight bear, that would be a different situation. But if someone's not able to put weight either on the hand or the foot, then that's kind of like a contraindication to using it. Yeah.
Yeah, he probably needs operation or serial casting or something to try and bring him back because he's
Right.
not in the realm of a possibility, at least
Right.
with his feet at this point. So
But for the hand, definitely we can work with it.
yeah, but he can perform tasks with his hand
Okay.
pretty well, but he's still got pretty well, his fingers are all bent and his
Yeah.
wrist doesn't really open. How
Right.
is there anything that deals with wrist?
So with the device, it's like a full device, so it goes up to here. So it's working on all of this, so it has wrist involvement too.
Okay.
So it still help with the wrist, yeah.
I'm gonna ask a lot of questions because I don't
Yeah, go
know.
for it.
I'm asking for people out there in YouTube land. Does it also deal with pronation and supination of the wrist?
So we don't go into pronation, supination, but we have seen indirect gains because of strengthening the muscles that are attached to the muscles that do pronation, supination. We've seen indirect gains. So it's not, none of the games are going to have them going into pronation, supination. However, we have seen patients that might have had like limitations with that, but through the games, strengthening all the wrist muscles and the forearm muscles saw an improvement with those pronators and supinators as well. Yeah.
Well, and also that's a kind of a further down the road process and getting your finger movement back. Typically, well, one thing people have a lot of trouble with is moving their fingers. They can do it with their wrist bent. You straighten out the wrist, they can't
Correct.
move their fingers.
Correct.
So
Correct.
you got to get that whole thing working.
Correct.
And then, because if you can't pronate and supinate, you're always
Right.
grabbing everything with and you
Correct.
can't do
Yep.
anything much with it.
So a lot of the games we have, like you will be in neutral, but we do have games that we call them like precision games, where you'll either have to stay in neutral for a certain amount of time while doing an exercise, or in flexion or extension to kind of work on that precision accuracy in those different positions. That kind of helps work on that as well. So like I said, we have like a wide variety of games that kind of works on everything. So people that even have, like, we've had some patients with elbow injuries, strengthening all of these muscles indirectly, they started seeing gains. So it kind of, everything works together. And like I said, since it's no contract, I always say if a patient's interested and wants to try it, go for it. Worst case scenario, you don't like it and you send it back.
Nobody says you can't work on pronation, supination outside the device,
Yeah.
You mentioned that if you need more, that it's interactive. It's reading how much help you need and adjusting to more or less depending on how you're doing that day or during a session if it changes.
Mhm.
What's the path to? I assume there is a path to no longer needing the machine and getting involved in what they call carryover, getting to a point where you've got carryover from the machine and you can do things without it.
Mhm. So if you get to the point where you're like, hey, I'm able to do I'm able to make progress and I don't need the device anymore. If you went the insurance route and you're still within that 13 months, you just send it back. If you have had it longer than that 13 months, it's just yours to keep. You don't have to send it back. You don't have to use it anymore. Kind of whatever you want to do with it because you own it at that point. It's like a rent to own situation. So if you're still using it post 13 months, it's just yours. You own it. But if you decide like you've seen all the progress you want and you feel like you're back to where you wanted to and it hasn't been 13 months, you would just send it back.
As a part of the games and part of the therapy, is there uh, a program that's working towards getting you there so you're not dependent on the device?
That's essentially kind of like the whole premise behind it, like getting you back to where you were. So initially it works on range of motion goals. That's the first thing. Once you've achieved like the full range of motion, then it's going to throw in resistance. So then you're working on strength.
Right.
So it's going to keep going and keep building, kind of to keep progressing you. And then it's just kind of like an individual decision of like, hey, I think I'm good, or I want to keep going. So if you want to get stronger, but you've reached that range of motion goals, it's going to keep throwing in resistance for you. So like we've had some patients that might have had like high flexor tone, so like kind of stuck here and not able to get into extension. Once the device gets you into extension, it's going to throw in resistance to where it's harder for you to go into flexion to kind of keep you out of that extension. So it's going to do like things like that to work on strengthening your muscles once you've achieved that range of motion.
Okay, I'm not the therapist, Katie is, but I'm a stroke survivor and she's not. My experience was that I had to get back full range of motion before anything really was working the way I wanted it to. I had to
Right.
get back full range of motion once I did, I did some stretching. That'll be my next question. Before, and then I worked on getting a range of motion back, full range of motion, like full elbow extension
Correct.
and that kind of thing. And I found that once I could do that, then I started working on building up strength. And as I built up my strength throughout the entire range of motion, I noticed that my spasticity started to disappear. By the time I had full range of motion, strength throughout the full range of motion, my spasticity had pretty much disappeared. So
Yeah.
that's the
Yeah, kind
path
of like
there.
I touched on earlier about the question with clonus. So we have a stretching game. It's just for stretching. It's all passive. It does not want you to do anything to help reduce that tone and spasticity. Kind of like you were mentioning. It is in a 5-minute increment, but you can do it. You can keep repeating it as many times as you want. We recommend starting with that before you ever play any other game. So if you do have like a lot of spasticity, it's working on reducing that spasticity before you start working on the games. Because if you're playing a game and your spasticity or like your tone keeps kicking in, it's going to make it difficult for you to play. You're not going to make much progress. So if we work on reducing it first, and then you'll start seeing a little bit more gains, and you won't have to worry about that spasticity preventing you from seeing progress. So that is something that we have. It's on there. It's called thermometer. It's like the very first game. It'll always recommend it first. You don't have to do it first, but especially if you have like spasticity, we always recommend starting with that first as many times as you want before starting to play the games.
Okay, well, that brings up flaccidity. Do people have to be a certain number of months out and have some level of spasticity? Does it work with, because
Nope.
in the early days, some people are just
Completely flaccid.
flaccid.
Yep. We have patients that are completely flaccid. At that point, the device will not be an active assist. It will adjust to know that you need it to do everything for you. So it's going to be bringing you through the range of motion for you. It's doing everything for you if you're flaccid. And that's kind of where it comes into like if you do reach like a pain threshold or you're at a point where something's painful, let us know because it's going to take you through the full range of motion since you have no active muscle engagement at all. So if you reach here and you're just like, that's painful, we will put in the computer, in the system that this is now your cap. So it's not going to take you to the full range of motion. That is now your max until either that pain level goes away or if it never goes away, that's just your new max. Because initially, if we don't put that in, it's going through the full range of motion for you. But if we know, like, hey, at a certain point we need to stop, we can set that as your new max, and then it'll consider that your full range of motion.
So how do you play the games
Have
when it's
anything.
not, when it's passive to transitioning to being active in a
I'm
sense?
sorry, what was the question?
How do you play the games when it's flaccid and transitioning into some active movement?
So
Like
the
if you have
sense
no active movement at all, you know what I
Yeah,
mean?
yeah. So it kind of does it for you. It's not anything that we have to adjust based on when you start the game. It's gonna let you start it and see what you can do. If it doesn't sense any muscle activation, it's gonna kick into passive mode and do it for you. If you're trying and it can sense a trace, so we call it a Mobot, which is a little robot that's in the device. It can detect as small as a tenth of a degree. So if it can see
Really?
anything at all, like a trace, it'll say, "Oh, look, he has something," and then it's working with what you have. But it
Okay.
can detect if you're doing anything. If you're playing a game for an hour and 20 minutes you're doing nothing, it's going to do it for you. And then at 25 minutes you start doing something, it's going to back off and work with what you're giving it. If you're only giving it 25%, it's going to do the other 75%. And then as you're progressing, if you start doing 50%, it's going to back off and now it's doing 50. So it's constantly adjusting to what you're doing. And if you're doing nothing, it'll kick into passive mode.
It's that sensitive dynamically?
Yes, it is very
Really?
sensitive.
Wow.
Yes,
Wow.
very, very, very sensitive.
So I came late. So is there a minimum activation that you need of
No,
movement to
no,
qualify for the insurance or
no,
anything
you
like
can
that?
be completely flaccid and have nothing.
Okay.
Yeah. We've had patients that started and had nothing at all. And in the beginning, it's going to be all passive until you start to get some of that activation back. And then it'll kind of start backing off as it sees you're doing more. And if it takes a while, it's just going to keep being passive. We just always say if you are completely flaccid, while you're playing the games, we want you to visualize as if you are actively doing it. So those brain
Okay.
pathways can get moving and flowing, and then eventually you will get that activation back. But it adjusts to you. Both the hand and the foot are extremely sensitive. So it adjusts to whatever you're at. Even if you only have a tenth of a degree, it can pick that up.
Well, and the point of passive movement, like opening your hand with your other hand, is always to make connections. So you
Yes.
mentioned something about thinking about it, which is basically mental imagery or mental
Yes.
practice.
Yep.
I know you know this, Caity, but for everybody else out there, if you're doing anything with passive movement with this device or on your own, you want to try and be thinking about it to help establish those connections. It's been studied. It's a valid type of therapy. It's actually a cousin of mirror box therapy, where you're essentially doing something similar. So, and one more thing, my shoulder wouldn't, well, nobody's shoulder much goes above level in the beginning, because the muscles that
Yes.
rotate your deltoid, your scapula, don't engage. So you get about here. If you put your hand here and you go like this, your scapula doesn't move. You start going like this, it starts rotating.
Rotating. Yep.
So I used a dowel to push up, and I had a bad pain in my shoulder. And one thing I found, this is an add-on to anybody, you're talking about those pain zones. Okay, so here's a stop that the hand, you can tell it, don't go past there, and that's your new normal. One thing I found was you want to, anytime you're doing passive movement, opening your hand, raising your arm and your shoulder, anytime you've run into a serious pain, you need to stop. You need to stop there, because you can do damage. And there, you have to learn, if you're doing that and you want to learn about pain, you have to learn what is a tolerable amount. A small amount is tolerable because that's how you're continuing to push. By the way, it took me almost a year to get, I can make the gun now and stick it straight up. It took a long time. My hands came back way before my shoulder did for some reason.
Yeah.
They say proximal to distal, but
Yes.
it doesn't always
It's
work
case
that
by
way.
case. Yeah, it's case by case. But that's another thing, like with stopping it, if you touch anywhere on the screen, the game pauses immediately. So you don't have to wait till you finish the game or like, let me push through. It stops immediately. And then you can just resume.
How do you
I
move
have one
that?
more question.
Okay.
Sorry, Ralph.
No.
Okay. So on the, and maybe I missed it because I showed up a little late, on the Motus foot, like when you're talking about range of motion, because I have a lot of spasticity and tone. So because you said something about one of the disqualification was about if you can't weight bear, for example, it doesn't work for you. It's not a good fit.
So we typically say no only because the games you're gonna have to be going into plantar flexion, which requires you to push down. So if you're not able, when we say not able to weight bear, meaning like your doctor has told you you're not allowed to put weight on that foot.
Okay.
If you have like a restriction, like you cannot walk on that foot because your doctor said, like mainly you see non-weight bearing like after surgery. So if it's just like you can't weight bear because of weakness, that's okay. It's non-weight bearing, like your doctor does not want you putting weight on that foot. Then we say no, just because you are going to have to apply pressure going into plantar flexion with the games. And sometimes we don't want to mess up, re-break, do anything of situations that's already going on. That's why we say wait
Okay,
until
that's
you're
fine.
able to weight bear.
No, I get that. I can weight bear, but my question is like, when you do the exercise, do you stand up doing that?
No. You're going to be sitting
Okay,
down.
that's what I'm getting at.
Yeah.
Because
You're going to be
I can't get dorsiflexion or plantar flexion.
okay. Okay, yeah.
You know
So
what I mean?
you'll sit like on a sofa in a chair, have the device down, and then you'll just be plantar flexion, dorsiflexion. You don't have to stand up. You're not going to be walking with it. None of that kind of stuff.
Okay.
Yeah.
Well, I was just sure like the mechanics of it, you know what I mean? I
Yeah.
mean,
Yeah.
the resistance will actually handle like a lot of high tone and spasticity.
Yes.
Really?
That's why we
Wow.
usually recommend that thermometer game because it is going to passively take you through everything and see, like, as you're going passively, your tone and spasticity are going to start to kick in. So it's going to detect, okay, at what point is it starting to go against me? And then it's going to help you work through it. But that's another thing. It's very gentle. It's not going to like just push you straight through it. It's going to
Yeah, I get it.
gently work through it so that it's also working with your muscles to start decreasing that. That way, when you are playing the games, it's more effective than
Huh.
you fighting the spasticity.
But
Wow.
you push too hard and you get into causing spasticity, which is velocity based, as you know. So
Yeah.
if you have a lot of spasticity, slow is good.
Yes. That's why the game it does it for you. It's passively because we don't want if we have you doing it actively, you're probably just going to go at it. Whereas if it's passively doing it, it can control how quickly it's doing, what it's doing, and kind of work with what give or pull your muscles are giving to it, what
Yeah.
resistance it's giving, and work with it through there. So it's passive and it is slow. It's over 5 minutes, so it does take a while, but it's kind of what you need to reduce that tone and spasticity.
Okay. The reason why I'm bringing this point up, because like about the resistance of like how dynamic that could be, is that like even if I'm standing trying to stretch with the wedge, trying to get
Mhm.
my heel down, I can't do it.
Okay.
You see what
Okay.
I'm saying?
Yeah,
It's a
yeah, yeah.
lot of, I mean, my whole weight can't bring that down.
Right, right, right.
You
Yeah.
see what I'm saying?
Yeah, yeah, I get it.
Yeah.
I mean, it's a good question. It's a very good question. Yeah.
Okay.
But yeah,
Yeah,
it
that's something
works
that
with me.
definitely I
It'll,
would
I think
probably
it'll
want to
help.
reach out to and
Yeah.
maybe do a consultation about.
Yeah.
But eventually, I mean, I'm sure it will definitely still help reduce that regardless.
Yes. Yes.
You know what I mean?
Yep, for sure.
When, Ms. Owen, this is sort of an aside, but when you say standing on a wall, normally you lean in and that causes you have to put that heel down farther. Do you do any weight bearing just standing up straight at a counter?
I do it with the rail, with the wedge. Yeah.
Okay. But
Yeah, I don't do it at the
the
counter. I just
normal
do it.
upright position,
I'm upright position with the wedge.
straight up, not leaning in or into a wall.
No, I try to actually lean into it to like try to put more, slowly lean into it to try to get that heel down. But there's so much tone and
Yeah, I
spasticity.
was gonna say sometimes when it's just like a lot of spasticity, it takes a lot of like slow practice to start to get that down. Because even if you're putting all your weight on it, sometimes if it's a lot of spasticity, it's just not gonna. It
Okay.
Right.
takes a lot to get to go down.
Again, I'm not a physical therapist, but I worked with two people and got their heel down. It took a couple of months of every day. I had them weight bearing. And the reason I was asking is just if you lean forward or lean into it, you're increasing the amount that that heel has to go down. So I would say, again, I'm not a therapist, but my experience was keeping them straight up was a key. And in one person's case, motivation's always the key because if you don't do it, you don't get better. And he kept telling me he was doing it, and I could tell he wasn't doing it because he didn't get any better. And then he wanted to walk. The PT loaned me a upright walker because they knew I would use it with stroke survivors, and he wanted to get on that thing real bad. So I told him, when you can put your heel down and weight bear on that leg for 30 seconds or a minute, we'll start with the upright walker. Well, all of a sudden, his heel starts going down. Why? Because he started doing it because he was motivated to get to that walker. Because if he could walk 70 to 100 feet, I think they said they'd take him back in physical therapy. And that was his goal. We got the heel down, took about 2 months, and then walked him 300 or 400 feet with the walker, and they took him back. And then eventually they wanted the walker back, and so I don't have it anymore. I could buy one, I suppose. Anyway. So
Yeah.
I'd be careful about leaning in because you're increasing that, when you get to where you get your heel down there, it'd be a good idea to lean in and force it to do that extra.
Yeah, without a doubt.
Have you
Yeah,
ever
but
tried
I'm not
doing,
at
have you ever tried doing heel raises on a set of steps where you got
how could I do that if I have no activation, no active movement?
no active movement in your leg at all?
Not at all.
And
Well, I
dorsal.
got it in my thighs. I can walk with a cane.
So you can weight bear, can you raise your heel at all?
No, I cannot. I have no movement to do
I
Yeah,
that.
so it's just like when he's walking, it's probably just like in neutral the whole time, right?
Right. Well,
Yeah, with the AFO, right?
There's no
Because I
active
wear an
device.
AFO.
Yeah.
Exactly.
I discovered this one day on my own. I was doing, I don't know, 500,000 heel raises every day. I came home one day from somewhere and it had a deck that was up one step and two railings there. And as I walked by, I put my hands on it, I started doing them, and I dipped down, and that gave me extra. If you have a place, my heel raise video, I show my front steps. I've got railings on both sides. You
Yep.
can move to where you can hold on with your strong side.
Yep.
If you dip below, if you're doing those and you dip below grade, they become plantar flexion. Um, they become dorsiflexion. Sorry, when you dip below grade. So you might try it, because what happens is you're now using the weight of your body, kind of like standing at the counter, to get that heel down, and there's nothing below it. So once you get to neutral, you can actually go below it. So you might try that. I'll send you that video.
Okay, that sounds good. Yeah, I think I just got multiple issues. That's why I can't be able to do that because I can't keep my foot down flat and my ankle roll.
Yeah.
Yeah.
Yeah, I understand. Yeah. It's
So
difficult.
if I
No.
stand on that step, which I have a perfect area to do that, my ankle rolls.
Yeah, it's gonna come off.
Yep.
All
Yep.
all bets are off if you got supination like that.
Yep. Exactly.
You
So
know,
that's
you have
my
to be
biggest issue.
careful.
Yeah.
Yeah. Does anyone else have any questions?
I ask everyone I could think of for everybody out
Yeah,
here.
you answered a lot of them.
Yeah.
Wait, I have one. How long
Yeah.
is each session?
So we recommend that you play the games for an hour, but it's kind of up to you. If you want to do 30 minutes, like that's fine. It's based on whatever you want. So when you start the device, it's gonna go off you. It'll stay on all day. You just play as long as you want. We just recommend like an hour a day, but you can break it up. You can do 3 sessions of 20 minutes, 2 sessions of 30, kind of whatever suits your lifestyle.
What if you do want to do 4 sessions of an hour?
You can do that.
Okay.
Yep,
That's
you
good.
can always do more. You can always do less. The studies that we have, people have done an hour a day, and that's kind of where we get our when we put out like our testimonials and things like that, it's based on an hour a day for 30 days or whatever the case might be.
Okay,
Well, if your body
after
does,
you're done,
go ahead.
you pass your slow start. Then how much when you into it do you advance to medium?
So you'll have access to all of them. So if you feel like, okay, now the low level is too easy, you can always go to the medium level games. You'll have access to all of them at all times, so you can kind of pick whatever you want, and just go on what you feel like. If you feel like these low level games are too easy, you can go to the medium games. Or you can just let us know and we can switch it out to where it's recommending medium games.
Can you mix and match?
Yeah, you can do anything. Yep. Because you'll
Okay.
have access to all of them. So it's not like you only have access to low level. They'll all be on there. You can, if you want to do a low level and a high level, go for it. We just recommend, like, we'll have it recommend the ones that are more on your level if you want. We don't have to do that. If we don't set it, it'll just recommend random games.
Well, plus, if you are good at something and bad at something else, you might choose to do less of what you're good
Right.
at and more of
Right.
what
Correct.
what you're not good at. So, all right, Rick, you raise your hand.
Trucks. Trucks.
So a few options. We bill insurance up front. So insurance primary does 80%, secondary does 20%. If you don't have a secondary or secondary doesn't cover, that 20% would be the patient's copay, but that's where the financial assistance program kicks in. If you can't afford it, you let us know and we figure something out for you. The patient only has to pay if we bill insurance and insurance denies it, you still get it for 60 days for free going through this group. So if you just go on the website and try to get it and you get denied, you will not get the 60 days. Because you're in this group, as long as you let me know and we get your information and I submit it through this group's QR code. If you get denied, you still get 60 days for free. And then after the 60 days for free, if you wanted to do a payment plan, we could do a month-to-month payment plan.
Okay.
It's still no contract though, whatever route you go. If you say, hey, I can only afford 2 more months, we do your 2 more months and then you send it back. So it's always up to you. It's never a contract, but we do bill insurance first. We always try the insurance route first. And then if that doesn't work, we'll talk about like a month-to-month situation.
Okay.
If you wanted it. If insurance denied it, you did your 2 months and you're like, I don't want to pay nothing, that's fine too. Send it back, all good.
Okay. All right.
Yep.
Well, one more thing I will say would be that if you're not overtaxing your muscles or you don't have pain, more is always better than less. Just like
Yes.
regular therapy, you can't, unless you get into one of those two things, overworking or you're forcing the other side of your body to overcompensate or you have pain, do all you can. Dawn, you have got a question? I got it. You're muted.
Yep, here we go. Sorry about that. Where do we get this QR code so you know we're in the group?
So I have the QR code. Basically, what you would do is either email or text me that number. I have everybody that's in the group, or I can get everyone's name that's in the group. Or if you guys just let me know who's interested, I can write your name down. That way, whenever you email me or text me, I know you're in the group. And then when I upload it on my end, I put you in under this group. That way, if you do get denied, you still get it for the 60 days.
Okay. And
Yeah.
your email address was Caity Claiborne, and then what was the rest of it?
It's Caity.Claiborne. Did you put it in the chat? At motusnova.com. I can also
Okay.
private message you, or I'll just put it in the chat to everyone so
Okay.
everyone has it.
It's in the post that you saw that you got the Zoom link from. Also, it'll be in the underneath the edited video when I put up
Okay.
the edited video. And Caity, if you want, I don't know how far that offer extends. A lot of people use their phones, and you can't read a QR code with your phone while you're on a phone unless you have a special app. Most people aren't that technical. If you want to, you can give me the link. But then you're going to get people who watch on YouTube, into your.
Yeah, that's fine. There's like no expiration on it. Someone
Okay.
6 months from now can watch this and say they want to do it. As long as because they came through you, that QR code is still valid. So as long as so I have access to the QR code, but as long as they either email or text me and say, hey, I saw this on Stroke Buddies, whatever, I'll know they're with you and I'll attach it to them.
Okay. Can you generate the link? Send me the link that the QR
Yes.
code sends it to you. That's, I assume, a unique link for you.
Yep.
That way people can click on it. I tend to put everything, by the way, everybody out there on YouTube, and everything that was in the promotional thing of this post. There were a couple of Google Docs, a link to the website, her email address. Everything now, we'll add this link. It'll all be in the description underneath the video.
And I did put my email in the chat just now. It looks like we have a question in the chat too.
Right.
Let's see. Do you have studies to back it up? Yes, we do. We do have studies. I have a sheet. If you want it, I can get it to you that has all the clinical study information on it that we have. If it's something you're interested in, just let me know. And then, do you need a doctor's prescription? Yes. So typically what we do is once you guys let me know we're interested, we can hop on a call at some point. I'll get your information, your doctor's number, all that kind of stuff. We send a fax to the doctor's office saying, this person wants to try this device. We send them a little description that says, type this up. We tell them exactly what to type, saying the medical necessity need for the device, and we send that to the insurance company. Once insurance approves it or denies it from there, then the process gets moved on. So we send it to the doctor, telling them exactly what to say to get the approval. And then we just kind of wait on insurance from there. But We kind of do all that behind the scenes. We really only ask you guys to help if we can't reach your doctor's office. But like I said, I stay in touch with you guys like every week or every other week. I'm giving you an update on what's going on. I'll tell you like, hey, it's been 2 weeks. We still can't reach your doctor. I'll send you an email that says, hey, call your doctor and say this, or give them this form and tell them they need to fill this out. I'll tell you exactly what they need to fill out and send it back to us. We try to keep it as simple as possible so you guys are not having to do too much. We have a whole medical records team, a team that talks to the doctors, all of that, that handles all of that. We just kind of ask you guys for help if we hit a roadblock and it's been 2 weeks and we haven't heard anything back.
That'd be real helpful, especially any language or whatever the doctor needs to put in. I once had a physical therapist
Yes.
write out the language that the doctor needed to put in the letter so that they could approve me for physical therapy.
Yes.
And bada bing, bada boom, magic happened, So if there aren't anybody else have any more questions, otherwise we're
I have
gonna.
another question.
Okay.
Yes.
Do you have, if you have a caregiver, can their individual help you put your exercise together and help you move your?
So if you
Okay.
have a caregiver, we get all that when we have like, I usually do calls with people to get a little bit more information about them so we can input that in the system and the computer knows exactly where you are when you get it. We put that in so when you do your 3-week check-in with the coach, we can either do the check-in with you or with the caregiver. We try to keep the caregiver involved as much as possible since that's the person that's primarily with you. But we can also do the check-ins with the caregiver if that's easier. And we kind of work with we work with the caregiver to see like what's your routine, what's your schedule, and how can we fit into that to kind of see what's best for you.
So Caity, I have a question.
Yes.
Would it be advantageous to us to have our physical therapist
Yeah, that's what I was gonna ask.
or our PCP? So I work with a physical therapist.
I usually say PCP because some insurances are going to kick it back and say that they need a PCP referral anyway. So we usually recommend PCP or neurologist.
Okay.
Prescription order anyway, and we're gonna have to go through them anyway to get it.
Okay.
So we usually just do that so we don't have to like get the PT to send something and then get the, and keep having to ask multiple people. We usually just say either do PCP or neurologist because they're gonna have the documentation we need because we need like the medical records saying you had a stroke. So even though the PT might have that, they want it coming, insurance wants it coming directly from the PCP.
Okay.
So, because we have some people that'll kick back and say, we'll approve it, but we need it coming from the PCP. So then we have to go to the PCP anyway. So
Yeah, I was thinking about what Ralph said, that he had to have his physical therapist say the right things so the insurance would approve it.
yes. So because this is a medical device and it's not like considered therapy, because PTs can only assign like certain medical equipment, they wouldn't consider it like a actual prescription from a PT. It's just insurance is very, very picky.
Okay.
Very picky.
I know that quite well. Thank you.
Yeah.
Well, I was 11 years out, which is why I needed some specific language, and I hadn't been in therapy for 4 or 5 years. Speaking of therapy, all this now made me think of one more question, which is, is there any, so, I'm in physical therapy, I got this device. What do I tell my physical, how do you maximize the device in terms of working with your physical therapist? I'm not sure, is there anything that Motus supports along that? Or
So you can, you can have like you can bring it into therapy with your therapist. I have some patients that bring it and they do it in therapy because it is billable time for the therapist. So you can bring it there and they can work with you on it. You
Good
can tell them
idea.
about it, things like that. Otherwise it would just be what you're doing in conjunction with the therapist, but you're doing it at home. So do what you're doing at therapy. And if they assign you like an HEP program to do certain exercises, you can do it while using the Motus Hand or the Motus Foot to kind of pair them together. A lot of people do bring the device to therapy and have the therapist work with them and then kind of tailor a program because we have the ability to set goals in the device. And sometimes the therapists like to be hands-on with that too. So just kind of depends on like kind of what you want.
Well, I hadn't thought through exactly how the process would work, but it seemed like if you have the device and you have physical therapists, putting them together and then getting the guidance of your physical therapist who sees you more than anybody at Motus could ever, might be real beneficial in terms of getting the most out of the device. Just my thoughts. So.
Yep. Valid question.
One final question.
Yeah.
Is one or the other device, is the Motus Hand or the foot easier to put on by yourself, or do you need help?
So they're the same. So
Okay.
when we came out with these devices, we built them based on the fact that sometimes if you had a stroke, you only have use of one side of your body. So you can put on the foot and the hand with only one side of your body.
Yes, 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 yes.
I
yes.
didn't believe it. I'll be very honest. When I first started with this
Okay.
company, I did not believe it. I was like, there's no way you can do this. That's impossible. I unboxed it. I pulled because the box comes with handles. I pulled it in my house, unboxed it, opened it, put everything together with one side of my body. They have videos when you first turn the device on that walks you through step by step that you cannot skip. You have to sit through and watch it. You have a guy that demos, he has it out and he walks you through how to place it, what to do to get everything on with one side of your body.
One hand. One hand.
Yep.
Yes.
Really? Wow.
Persistence.
Okay.
Persistence is the key.
And then we always have the recovery coach. If you need help, they'll get on a video and walk you through it as well.
Okay.
There's like plenty of options. We're never going to give it to you and be like, good luck. I hope you can get it on. They're going to
Well,
walk you
that's
through.
that's
tries to
huge.
be- yeah, we try to
That
make
is
it
so
as
huge.
easy as possible.
It might take some practice and persistence,
Yeah.
but I mean, I
It's a
did
good
a
therapy.
video. I did a video recently putting on a jacket one-handed, and it was a zipper jacket. I got it on. That was all the guy wanted. I said, "Can I zip it up one-handed?" I figured out how to do that and zipped it up with my teeth. I'm currently working. I have use of both my hands, but I'm currently working on how to make a sandwich one hand. I'm right after this meeting. I'm gonna go make my lunch one-handed, just because that way I run into the real problems that people have, and I can solve them and make a video about it. So.
Yep.
Anyway, persistence is
question?
always the key, and more is always better if you don't get involved in
Agreed.
pain or overworking the muscles. So,
Agreed.
any more
Other
questions? Any more
at all?
final questions?
If not, I put my email in the chat. You guys can feel free to email me my number. He has it. Text me, call me, whatever. I always have my phone on me. So if you have a question at 11 o'clock at night, text me. I'm probably up.
Oh, come on.
All right. Well, if there are no more questions, I just want to thank you for taking time out of your schedule and
Thank you.
talking to us about this. And once again, for everybody in YouTube land, click on the description if you want to get in touch or you want to see more supplemental information. We also put clickable timestamps to key points that were talked about. So if you didn't attend today and you're just seeing this on YouTube, you can replay anything that you want. So thank you, Caity. We really appreciate it.
Yeah, of course.
Thank you. Thank you. Thank
Of course,
you.
of course.